This is Starting the Conversation, and I'm Luis Gutierrez Mock. I'm with the UCSF Pandemic Initiative for Equity in Action. Today, we'll be talking about interviewing skills and building rapport, really thinking about setting the agenda and starting the conversation for contact tracing. Our learning objectives for the day are for you to be able to define active listening skills, to apply them to interviews, learn the steps to setting the agenda, and beginning the interview process itself. When we think about interviews and the contact tracing interviews, we have some key considerations. We want to first take a contact-focused approach to each call. It's really important. Each person who we're speaking with is unique in their circumstances and should be respected. We might think about this as saying, we're all in the same storm, but we're definitely not all in the same boat. Secondly, we want to think about our tone of voice, how information is conveyed, and how questions are asked really can help in building trust. Especially thinking about tone of voice because we're having a conversation on the phone with somebody, and really our tone of voice is the first thing that people are going to be able to pick up on. It can also be a lot of really hard, scary news. We're calling somebody who doesn't know us. We're trying to establish that trust and rapport right away. It's really important to try and understand the experience of the person who you're calling, the contact. Listen to their responses. We're really thinking about finding ways to validate them and to show compassion. We'll talk a little bit more about that later. It's important to recognize that you're asking a lot of personal questions. The contact might not feel like sharing some of these questions. So in that case, we want to ask, really listen, and try to use some of the active listening skills that we'll be reviewing today to be able to elicit the information from the contacts. So I'd like to ground our discussion today about health coaching in a story by introducing you to Elsie. Elsie is one of the people on your contact list. She's 65 years old and immigrated from the Philippines when she was 14. Elsie was a middle school teacher for many years, and she recently retired. She speaks Tagalog and English. Elsie is pleasant when you speak with her. A couple of times she has to ask you to wait while she helps one of her grandkids get a snack. Elsie says she has a hard time keeping up with all of the news about COVID-19, and she finds the public health guidelines to be confusing. When you tell her that it's recommended that she quarantine for 2 weeks, she asks, well, isn't that what we're doing now? When you explain the difference between social distancing and quarantine, Elsie says, that's not going to work for me. My daughter needs me, or she can't work and pay rent. My neighbors depend on me to bring them groceries. I need to walk my dog. Thinking about Elsie's situation, can you think to yourself for a moment, what challenges does she face as she seeks to observe quarantine? What challenges do you notice? I think something like she has a lot of people depending on her. She's not sure that she can do this. She needs to take care of her dog. She has to help her grandkids. There's a lot of people who are really looking towards Elsie. We can reverse that and think about what strengths and resources Elsie has. Take a moment too to think about what strengths does she bring as she seeks to observe quarantine. And if you thought to yourself, she's got a really strong social network, you're right. She has a lot of people in her life who it sounds like would probably be a really great source of support for her. As contact tracers, we want to help our contacts identify the strengths that they have to bring in as they seek to quarantine so that they can be more successful. So as a culture, we can think of health coaching as an approach to talking with people that's client-centered, strength-based, and collaborative. So what does that mean? By client-centered, I mean meeting people where they are in the complex context of their lives and prioritizing their values and their concerns. In Elsie's case, she's the central support of a wide social network. Her daughter, her grandchildren, her neighbors, and even her dog depend on her. By strength-based, I mean that health coaching seeks to understand what people already know and what they are motivated to do, and to build on that knowledge and motivation. Elsie's expansive social network is also a strength as she seeks support for the period of quarantine. Being collaborative means engaging people as the experts in their own lives to figure out how to carry out complex behavior change. In your conversation with Elsie, you will bring knowledge about COVID-19 and quarantine, and Elsie will be the expert in her own life. And only by engaging her as an expert would we be able to reach a plan that would fit and work for her. So, as a skill set, we define health coaching as a set of tools to support people in gaining the knowledge, skills, and confidence to be active participants in caring for their own health. I'll be sharing some of those tools in the videos that you'll watch in just a few moments. So, health coaching has been researched extensively in chronic disease management and addiction. You might be thinking to yourself, what does this have to do with contact tracing? Evidence shows that health coaching tools are effective in supporting people in making difficult changes to their daily lives. Much like improving diabetes control or quitting smoking, adhering to a quarantine involves a lot of pretty significant behavior change, and it's not easy. It could require changing our physical space, it could require changing our social relationships, and then we also have practical barriers like whether or not people have enough food for 2 weeks and other supplies, or how they'll communicate with their workplaces about not coming in. As we think about health coaching, we can use Aesop's fable of the wind and the sun. So the wind and the sun were arguing about who was the strongest. The wind proposed a competition. Do you see that, traveler? Let's see who can remove his cloak from him. The sun agrees. The wind goes first. The wind howled and whipped around the traveler, tearing the cloak almost off of him. The wind was trying so hard to get the traveler to do what the wind wanted to do. But the traveler only wrapped the cloak more tightly around himself. Finally, the wind was exhausted and gave up. The sun goes next. The sun smiled warmly on the traveler, gently increasing in intensity. The traveler stops to rest, removing his cloak. So sometimes when we try to engage people in behavior change, we really try to overwhelm them. We might use shame. We might be arguing. This is what the wind was doing. The sun, however, we could say encourages, empathizes, affirms, nudges, even reflects and nurtures. So this is the approach to helping people find a motivation and act on it that we want to engage with. We want to think about being like the sun. And rather than thinking that we know what's best for people and we know that there is a behavior that we want our contacts to engage in, we want to think about what it is that we can do, what support that we can provide to help the contact choose to engage in that behavior themselves, rather than us forcing them to do it. So as we explore the challenges that you may experience as a contact tracer today, I'd like you to come back to this image and think about what would it be like to be more like the sun? Let's look at an example of what it might be like to be like the wind. How can you expect me to quarantine for 2 weeks? My parents are over 80 and I have to check on them every day.
Well, you're going to have to find someone else to take over for a couple of weeks.
I'm the only one who understands their health issues and what they need.
Yeah, but you don't want to get them sick.
Yeah, I just don't think you're understanding my situation. Right, after having watched that example, if you could think about how do you feel like, how do you think that contact is feeling? How do they feel? So the contact tracer in this video did something that a lot of us do. When faced with what she felt like was resistance, she pushed back. She was like, this is important. She really wanted the contact to pay attention. So she urged the contact to think about the consequences of not quarantining. And so even though both of these things are true, many of you may have observed that the contact ended frustrated and really felt unheard. So we're talking about an alternative to, what's really kind of like a wrestling match or trying to get somebody to do what it is that we want them to do. All right, we can move into some additional principles of our health behavior coaching for starting our interview. So first we want to think about expressing empathy. So this really refers to the contact tracer's ability to understand with sensitivity and accuracy the contact's experience and feelings. We're not really thinking about doing this sympathetically so much, but really that we want to be sensitive and accurate. We also want to support self-efficacy. So this means we affirm the strengths and the competencies of the contact. We think about supporting any optimism that change might be possible, that this contact believes that change is possible for them and that they could engage in that change. We communicate that the decision and responsibility to change behaviors belongs with the contact. And then believe in the person's ability to make positive changes in their own life. So help them to believe in their ability to make those changes. We can also think about using discrepancy and developing discrepancy. So this enables our contacts to see that their present situation may not necessarily fit into their values and what they would like to see in the future. So this principle of developing discrepancy is really based on the understanding that the motivation for change is created when the person perceives a discrepancy between their present behavior and maybe some important personal goals. We could also think about how does continuing to go to work fit into what their interest is in not exposing family or friends. If somebody is sharing that it's important for them to keep their family and friends safe or to keep the people who they live with safe, there's some discrepancy there if they are not wanting to stay home. So we could help them to explore that. Finally, we want to think about rolling with resistance. So let's resist the urge to correct our contact and to tell people what to do. I don't know about you, but I don't really like it so much when people tell me what to do. And so we want to think about helping our contacts decide what behaviors they'll engage and and then support them in those behaviors. Thinking about some of our active listening skills, we like to use the acronym of OARS when thinking about these. So that stands for open-ended questions, affirmations, reflective listening, and summarizing. This is a common acronym that's used in a lot of counseling styles. It can really help you to move more smoothly through the interviewing process. So our open-ended questions are ones that can't be answered by a simple yes or no. These are questions that might begin with like, how would you do something like that? Or can you tell me a little bit more about? We'll use these throughout the interviewing process, and it may be helpful to use them to interject to be able to understand the unique experiences of the person who's being interviewed. Thinking about affirmations, as the person responds to questions, in almost all cases, they're going to give you information about their concerns, their abilities, and their willingness to communicate honestly with you. When appropriate, we can use affirmations to help connect and engage the person. We might say something like, it's clear that you deeply care about your family, or it's impressive that you work so hard to provide for your family. We could also say something like, your questions show me that you're really interested in doing what you can to protect people. With reflective listening, people may communicate affect in their responses that may need to be recognized and validated. So these are feelings. Affects are the feelings that they could be communicating in their responses. Reflective listening acknowledges those feelings and helps to engage and then respond to the person's concern. So something like, you're frustrated with all the challenges that have taken place. With summarizing, we summarize the person's statements and concerns to help understand their needs for support and to also help provide some further resources and maybe check in with our understanding of what they're sharing about their experience. Let's dig into each of these a little bit more. Our open-ended questions, again, they really invite other people to tell their own story in their own words without us leading them in a specific direction. The key thing about open-ended questions is that we really have to be willing to listen to the person's response. Closed-ended questions are ones that, again, are answered like a simple yes and no. So an example of a closed-ended question would be, do you know what COVID-19 is? Do you have any questions? Have you been social distancing? You can see that each of these questions invites a single word response, and it's going to be really difficult to continue to have a conversation with somebody to be able to share information about how to stop the spread of COVID-19 and to support them in quarantine if all we're going to do is ask them yes or no questions. So the alternative to that is our open-ended questions. Have you heard about the risk of COVID-19? Rather than, do you know what COVID-19 is? What can you tell me about the risk of COVID-19? These questions invite the contact to tell their own story. And they also let the contact share with us things that they already know. Some more open-ended questions. We have a lot listed here. Again, open-ended questions can't be answered by a simple yes or no. And they really help us to get a bigger picture of the contact's concerns and the situation within their life and really the context of their life. It helps us as contact tracers with giving relevant information, referrals, and appropriate recommendations. So some additional examples might be, what do you know about COVID-19? What support do you need in order to quarantine? What's the first thing you need to do to make these recommendations work? All right, on to our A in our ORs, our affirmations. So affirmations are a chance to really celebrate what someone is doing well or what they know. A couple of examples of affirmations. You're clearly a very resourceful person. That's a really good suggestion. If I were in your shoes, I don't know if I could have managed nearly so well. And we really want to think about using affirmations as much as we can, anytime, especially when people are sharing any positive behavior changes that we're seeking to support. So if we ask somebody, for example, what have you been doing to protect yourself from coronavirus? Or what have you been doing to stay safer from coronavirus? And the contact responds and says something like, I've been wearing a mask when I go out. I've been trying to stay 6 feet away from people. We want to really affirm those behavior changes. And we want to say, I'm so glad that you're wearing a mask. Thanks so much. It sounds like you really know a lot about how to protect yourself from COVID-19. Would you mind if I shared a few other ways that you could protect yourself and your communities from COVID-19? Moving on to our R in our ORs, reflections. So the reflections give the message that I'm listening to you, that the contact knows best about their life. And it's really putting into our own words what the person is saying. And it can also help them to hear what they are saying. And we want to think about saying this as a statement rather than a question. You know, questions might demand an answer and it can sound judgmental. Like if we were to ask, why aren't you staying home? Why haven't you stayed home as we discussed? You know, it sounds really judgmental, and that's not the tone that we want to communicate to contacts. We want to support them, and we want to acknowledge that this is a difficult time, and people are really trying the best that they can. And with these reflections, we can help get to some of the feelings that are behind some of the things that they might be sharing with us and saying. A few ways that we can engage with reflections are repeating or rephrasing. This is when we would substitute words or phrases and stay pretty close to what it is that the contact is saying themselves. We can think about paraphrasing. So we might restate what the contact is saying. And then we have the deepest form of reflection, which would be the reflection of feeling. So us as the contact tracers would emphasize the emotional aspect of communication through their feeling statements. And we could think of these reflective statements as like a small gift that we're offering to somebody when we listen carefully enough to distill down the essence of a feeling or idea. Finally, our S in the ORS stands for summary. So summaries really help to ensure that there's clear communication between the speaker and the listener. So we would want to begin with a statement indicating that we're making a summary. Like, let me see if I understand that. Here's what I've heard so far. Can you let me know if I've missed anything? We want to think about being concise. And then we want to end with an invitation or a question to ask them, is this correct? Is this information that I just summarized correct? Did I miss anything? What other points are there to consider if that is accurate? So we invite you to practice on your own because these skills may seem really simple. I promise they're harder than they look, and they really require a lot of practice. So if you could practice with some family or friends, just practice going through your ORS and using different skills within the ORS to be able to reflect back statements to your friends, to summarize statements, to use open-ended questions to elicit additional conversations, and to use some affirmations within a conversation. And I'd like for you to think about how you might be able to provide a reflective statement to the examples. So the first one, this is so unfair. I wear my mask and do everything I'm supposed to do, and still I get this? A reflective statement for that could sound like, you're really frustrated that you've been doing everything correctly and you still have to quarantine. Another example could be, first we have to shelter in place for months and now I'm in quarantine for 2 weeks. How can anyone expect me to keep a job at this rate? We could say, sounds really difficult for you and you're really concerned about keeping your job. There's a lot of emotion behind some of the statements that I read. And our reflective statements can be a tool to help diffuse some of that emotion. And we can also try to remember that as we're doing contact tracing, if we're hearing this emotion behind the voice of our contacts, we might think to ourselves that we don't know the context of this person's life. We don't know what it is that they've experienced, and it's unlikely that they are mad at us as somebody who's calling them on the phone. We've had a very brief encounter with them so far. What they might be angry, frustrated, or scared about is the context of living with COVID-19 and dealing with quarantine and knowing that they have been in close contact with somebody who's been tested positive. Let's watch an example of reflective statements used in the context of an interview. How can you expect me to quarantine for 2 weeks? My parents are over 80 and I have to check on them every day.
Your parents really depend on you.
Yeah, they do. I'm the person who takes care of their groceries. You know, I even fill their pill boxes every week. And if I can't see them, I don't know how I can be sure that they're safe. My dad has dementia.
So you're really worried about your parents' ability to take care of their needs.
Yeah, but like, of course, I don't want them to get sick.
So I imagine this adds to your worry as well. On the one hand, you really care about your parents and want to check in on them to make sure they're okay. And at the same time, you don't want to take the chance of them getting sick.
Yeah, it's like I'm between a rock and a hard place.
That's a really tough situation.
Yeah, it is.
Would it help to talk through your options for how you might make sure your parents are taken care of over the next 2 weeks?
Yeah, I think that would help. Thank you. All right. So welcome back. I hope you enjoyed that. If you could just think about How do you think that the contact was feeling at the beginning of this conversation? Probably pretty scared, a little defensive. What about at the end of the conversation? You could see that as the contact tracer was engaging with the contact and was using those reflective statements, it helped to diffuse some of the emotion that the contact was experiencing. And so the contact was probably feeling like, maybe they could do quarantine and they could try to figure this out with the contact tracer's support. All right, we'll be focusing on 5 tools from what we like to call a health coaching toolbox. These tools are setting the agenda, ask, tell, ask, closing the loop, action planning, and addressing motivation. We're going to go first to the first skill, setting the agenda. Before we talk about what setting the agenda means, let's look at an example of what setting the agenda done poorly looks like.
I'm calling to let you know that you have been identified as a close contact to a person with confirmed coronavirus. I have some questions that I need to ask you.
Oh, okay.
How are you feeling?
Fine, I think.
Who is your medical provider?
I guess Dr. Flores over at the Kaiser Angiri. Hey, what am I supposed to do with my prescriptions?
Don't worry, I'll send you information about that. What kind of work do you do?
I'm semi-retired, but I have a home daycare.
Okay, so you can get a test with Dr. Flores and you need to close your daycare for 2 weeks.
I'm sorry, I have to get back to my lunch.
I'm calling to let you know that you have been identified as a close contact to a person with confirmed coronavirus. I have some questions that I need to ask you, and I wanted to address any questions or concerns that you may have. May I ask what is on your mind right now?
Oh, my head's spinning. I'm just thinking about whether my husband is to tell his workplace or stop working. And how am I going to get my medications?
Okay, so I'm hearing that we should talk about your options for getting prescription refills and how your husband should handle his workplace. Is there anything else pressing on your mind right now?
No, those are the big things.
Okay, that sounds good. And I'd like to talk about any symptoms you may be experiencing and share some information about coronavirus and quarantine. I would also like to assist you with testing or other support services that you may need. We will also have time to address any questions that come up for you during our conversation.
That would be good.
Okay, great. So how about if we plan to talk about your prescriptions and your husband's work first, and then I will ask some questions about your symptoms and quarantine, and we can discuss any other support you may need, including testing.
That will be fine.
Great.
All right, so that was setting the agenda done poorly. If you could think to yourself, how was this contact feeling? So in the video, the contact tracer did not ask the contact about the contact's questions or her priorities for the conversation. So as a result, the contact was distracted by her unanswered concerns about getting her prescriptions. The contact tracer also did not lay out the goals of the call. And this resulted in the contact experiencing a barrage of questions without really understanding what the purpose was. The contact in this scenario cut off the conversation, which might be a signal that she's not convinced of the value and the purpose of the conversation. So setting the agenda is about laying out our priorities for the call, but it's also about understanding the priorities of the contact. Fundamentally, setting the agenda is really about an agreement between our contact and ourselves about how to best use the limited time that we have available. So there's 4 steps to setting the agenda. The first step would be to ask, what questions or concerns do you hope to talk about today? This could sound something like, how do I take care of my dog? And how can I get food for myself? Then we want to share what we hope to talk about. This could sound something like, I'd also like to ask you about any symptoms you may have had. The next step is to identify what from the contact's concerns you can address today and what you might need help in seeking help with and answering. This could sound something like, I'm happy to share some resources for food for you. However, I'm new in my role and I'm not sure about resources for your pet. Would it be okay if I get back to you about that? Finally, we would briefly summarize all of the agenda items, both ours and the contacts. And this could sound like, great. So today we'll be talking about food resources, symptoms, and I'll ask my supervisor about resources for your pet, and I'll get back to you. So let's go back to the same interaction and see what setting the agenda looks like when it's done the right way.
I'm calling to let you know that you have been identified as a close contact to a person with confirmed coronavirus. I have some questions that I need to ask you, and I wanted to address any questions or concerns that you may have. May I ask what is on your mind right now?
Oh, my head's spinning. I'm just thinking about whether my husband is to tell his workplace or stop working. And how am I going to get my medications?
Okay, so I'm hearing that we should talk about your options for getting prescription refills and how your husband should handle his workplace. Is there anything else pressing on your mind right now?
No, those are the big things.
Okay, that sounds good. And I'd like to talk about any symptoms you may be experiencing and share some information about coronavirus and quarantine. I would also like to assist you with testing or other support services that you may need. We will also have time to address any questions that come up for you during our conversation.
That would be good.
Okay, great. So how about if we plan to talk about your prescriptions and your husband's work first, and then I will ask some questions about your symptoms and quarantine, and we can discuss any other support you may need, including testing.
That will be fine.
Great.
What a difference, right? So in this dialogue, the contact tracer came to an agreement with the contact about how they would use their time on the phone. Because the contact has described her primary concerns and being reassured that they'll be addressed, she's much more open to discussing other topics, like symptoms that might be on the contact tracer's mind. So as we wrap up this first section, I'd like to make an argument for why we use some of these interviewing techniques. First of all, I'm just going to say it works. We know that these interviewing techniques have worked. We use them a lot with different types of health behavior coaching and a lot of different types of behavioral interventions. We know that a small intervention can have a really big effect, especially when we're thinking about stopping the spread of COVID-19. We also know that the opposite approach would be a more confrontational style of counseling has poor results. And it also makes our jobs easier and more enjoyable when we're seeking to collaboratively partner with our contacts and to help support them in the behavior changes that they feel like they could do in ways that would best fit their lives. And finally, this just reflects the values of contact tracing.